called The Vasculitis and Autoimmunity, a Common Thread, which is being presented now. We have some wonderful presenters today. The first will be Dr. Noel, who is the director of the Center for Autoimmune Disease Research at Johns Hopkins University. The next speaker we'll have is Dr. Peter Mekel, who is the director of the Vasculitis Center at Boston University and who will soon be transitioning into a position as the chief of rheumatology at the University of Pennsylvania. We also have ARDA's patient educator, Patricia Barber, who will be giving you some information on resources for patients that you can find from the Autoimmune Disease Association. And additionally, we will have Joyce Coleman, who is the executive director from the Vasculitis Foundation, who will be doing the same but for the vasculitis group. So all of the resources that you can obtain from that group. And without further ado, I will give over our presentation to our first presenter, Dr. Noel, who will be giving a discussion on the common thread of autoimmunity.
Good evening, ladies and gentlemen, and good evening from Baltimore. It's evening here, and I understand that there are people in other time zones, so I greet you in whatever time you happen to find yourself in. Very honored to be the first speaker on a momentous event that is the first webinar sponsored by the American Autoimmune Related Disease Association. It's a little bit like the first telegraph message, which actually went from Baltimore to the White House in Washington, sent by Mr. Moore, who invented the telegraph. He said, "What hath God wrought?" So I feel the same way about this mechanism of presenting. So I'd like to spend the next few minutes talking with you about autoimmune diseases generally. We're going to be centering most of our discussion this evening on one particular autoimmune disease, namely vasculitis. But I would like to convince you before the evening is over that vasculitis is a member of a large family, and that is the family of autoimmune diseases. Now, like all members of a family, autoimmune diseases share a genetic background, a pool of genes, and so the autoimmune diseases also are connected or related to each other through common genetic traits.
Excuse me, Dr. Rose, you'll need to accept the screen so that people can see your presentation.
Oh, okay. Well, then I will, does it say show my screen?
Yes. You see that?
And then show, now I'm not sure. What do I do next?
Just click show my screen.
Show my screen. I'm looking for that on this device, and I don't see.
Hold on just a moment. I'll resend it to you, sir.
There we are. All right. Can that be seen now? How are we doing?
Try it now, Doctor.
Try it now, Doctor. Okay. All right. So I'm going to be talking then about the common traits, or as we say, the common threads of autoimmunity. And to emphasize that the autoimmune diseases, different as they are, all have many features in common, and that these are largely the most fundamental features, and I believe the ones that are in the long run going to prove to be the most important. It's a little bit like cutting dandelions out of your lawn. If you can think of autoimmune disease as a group of dandelions, and you can either approach the problem by knocking off the top of each dandelion individually, which is unfortunately what we have to do now, or to dig out the roots. And if you would, I'm going to try to emphasize some of the roots of autoimmune disease. So I'd first like to define two terms that I think are important for us in understanding the basis of autoimmune disease. And the first one is autoimmunity, which is just the term that describes an immune response, the same immune response that protects us against infection. But in this case, it's an immune response directed to normal molecules that are normally within the body. And so in autoimmunity then is a response that is going on in our bodies all of the time, because as we are recognizing the many pathogenic organisms that can be entering our body, we are also recognizing molecules in our own bodies. So autoimmunity is something that's occurring all the time. On the other hand, normally autoimmunity is carefully controlled or carefully regulated. Sometimes, however, those regulatory devices leave us, and in those cases we find autoimmune disease occurring. So autoimmune disease then is a disease which is caused or at least significantly promoted by autoimmunity. And the important lesson that we have to take from this is that autoimmune diseases can occur anywhere in the body, and therefore they present themselves clinically in very, very different ways. So the autoimmune diseases historically we have thought of separately. This is not advancing on my screen as I hoped it would. So there we go. So if we think of all the autoimmune diseases collectively rather than individually as we customarily do, we realize that in the aggregate autoimmune diseases turn out to be very common. In fact, there are at this time somewhere between 14.7 and 23.5 million people with autoimmune disease. That's 5 to 8% of Americans with an autoimmune disease. We can say then that if we think of autoimmune diseases collectively, they are among the major clinical and public health problems in our country. They are important causes of death, particularly among women, and for comparison, the autoimmune diseases are about as frequent as heart disease, the major killer in this country, and there are about twice as many cases of autoimmune disease as there are in the United States. So this is an important and ongoing disease problem. On the next slide, if it appears, you have a graph in which a number of autoimmune diseases are listed along the bottom, and the prevalence of the disease, that is the occurrence of the disease, is illustrated by the bars that go up. The taller the bar, the more the disease. And there are two striking things about a graph like this. First of all, most of the autoimmune diseases, if we look at them individually, are relatively uncommon. And if we thought of them only that way, I'm afraid they are not questions which often come to public attention, or even, I might say, to the attention of funders. There are three diseases that are relatively common that you see at the left side, and those are Graves' disease of the thyroid, that's high thyroid function, rheumatoid arthritis, and Hashimoto's thyroiditis, which causes low thyroid disease. So these three are relatively common, but virtually every autoimmune disease we study in purely statistical numbers is relatively rare. Now, of course, for the patient, it's 100% because that's the whole problem. But you can see that if we looked at them only individually, we would not really understand how important the autoimmune disease problem is in this country. I might also point out that these bars are made up of two parts. The upper part is stippled, and that represents the proportion of males, and the filled-in parts are female. So most, but not every, autoimmune disease occurs more in women than in men. That's another prime common feature of autoimmune disease. And the next slide, if it appears, will show exactly that. So on this graph, we also have bars, and the red bars are women and the blue are men. The interesting thing is, however, that while these diseases are predominantly in women, they're not only in women, that they also occur in men, and some diseases, like type 1 diabetes mellitus, way over there on the right side, actually occurs more in males than females. So what we learned from this is that there is an important relationship between the endocrine system and the immune system. So these diseases, due to an over-vigorous immune response, occur more in women. But that's not a simple equation because this is a gradual transition. So that's another one of the common features of autoimmune disease. Another interesting feature is that autoimmune diseases occur differently in different parts of the world. And, for example, most autoimmune diseases are more common the further one is from the equator. This slide shows the prevalence of autoimmune diseases in some countries in Europe, and the parts of Europe that are filled in with a gray color are the parts where autoimmune diseases are more common. Those are the northern countries, and they're less common in general in the southern countries. Of course, in the southern hemisphere, in Australia, it's exactly the reverse. So there is an important environmental component of autoimmune disease, as well as a genetic component of autoimmune disease. Another important feature of autoimmune disease, we'll see on the next slide, is that autoimmune diseases generally occur at certain ages. Now, most of the autoimmune diseases are more common in women than men, and this is a slide showing the prevalence of the autoimmune disease multiple sclerosis in a little city where this could be studied in all of the inhabitants. And the filled-in bars are women, and so again you see it's more common in women than men, but you'll also see very strikingly these are mainly, not entirely, but mainly diseases of young women, and particularly women in the childbearing years. And this is another important lesson of autoimmune diseases. They tend to attack mainly women in their most vulnerable ages. Now, of course, there are some autoimmune diseases like type 1 diabetes that occur in childhood. There are some like rheumatoid arthritis that occur in older people. But predominantly, most of the autoimmune diseases are diseases of young women. The next slide also traces an interesting common feature of autoimmune disease, and that is that almost every autoimmune disease that has been seriously studied is increasing in prevalence. So this is not only a big problem, it's a problem that is getting greater every year. So let's look at the next slide, which illustrates the common features as far as the mechanism of autoimmune disease is concerned. And we will see that autoimmune diseases really come from a combination of a genetic predisposition, that is, something we inherit, and then something from the environment that serves as a trigger. And it's these two things acting together that actually produces autoimmune diseases in the human. Now, what sorts of things are we talking about? Well, if we look at the next slide, we can look at some of the factors that go into evidence that we have a genetic predisposition. And one of the striking ones is that autoimmune diseases tend to cluster. They tend to occur together. And so we often have clusters of autoimmune diseases in the same family. They may or may not be exactly the same disease, but we will find more than one autoimmune disease very commonly in the same family. And we may find that a single patient may have more than a single autoimmune disease, may have 2 or even 3. But the real evidence comes when we study twins, and if we look at twins that are genetically identical, we find the co-occurrence of an autoimmune disease is very high. That is, if one twin has multiple sclerosis, the chance of a second twin having the same disease sometime in his life will be about roughly 30%. So that's a significant co-occurrence. And the last item down there called HLA means that there are major genes that have already been identified that are responsible for this co-occurrence of autoimmune disease. On the other side, you see a list of the many factors that have been implicated in the causation of autoimmune disease, or at least in the triggering of autoimmune disease. And drugs are very high on the list because we have the best evidence that some drugs can cause autoimmune diseases in genetically susceptible people, although that is relatively uncommon. And then you see infectious organisms as probably being an important cause, although there we don't have yet as good information. Foods, pollutants have always been implicated without, again, the most solid information. We know, as I said before, that the hormonal system, hormones are involved, and even things like stress. So there are many things that can serve as the trigger of an autoimmune disease in a genetically predisposed individual. So if we look at the next slide, we can see that we can sort of put together all of this information into a diagram in which we see that the big bubble is the environment. That's about 70% of what seems to be the instigator of autoimmune disease, but that the rest of the autoimmune disease is something we inherit, and there are 2 major families of genes, some that we call major histocompatibility genes, MHC, and some that are genes that are more directly involved in just the regulation of the immune response. In fact, all of the genes that we know of are very much involved as serving as regulators of the autoimmune disease. So to sum up on the next slide, we can say that, well, first of all, let me just say that, that the future of autoimmune disease is moving very rapidly, and a lot of it is developing ways to better predict autoimmune diseases before they're full-blown, before they are almost irreversible. So prediction is really the key word in modern autoimmune disease research. And to go on to the summary, if we can move to that, the main point I've tried to make in these few minutes is that autoimmune diseases represent a large and a growing problem, a growing health problem, both medically and I might say even financially in the United States. Autoimmune diseases are highly diverse one from another because they can affect any site in the body, and the way they present medically, clinically, depends upon where the diseases occur. But that there are fundamental mechanisms in common, and these are the genes that are predisposed to autoimmune disease to make people more or less vulnerable. And those are generally genes that are endowed with the responsibility of regulating the immune response. But in humans, it seems we also need something from the environment to set the process going. And that finally, prediction is the coming field in autoimmune disease, in my opinion, because we know that autoimmunity in the form of autoantibodies can be present even before autoimmune disease occurs, so that it will be possible in the future to intervene before the damage is irreversible. So, ladies and gentlemen, that's a brief sum of the common threads of autoimmune disease. Thank you very much.
Thank you, Dr. Rose. We do have one question from Daniel. He's curious to find out what kind of residency someone would go through to work with autoimmune diseases. And we had another question about, why isn't there a specialty for autoimmune diseases? So I thought you could address kind of the, how does someone become an autoimmunologist such as yourself?
Okay, that's an excellent question. And the short answer is that at this time there is no single autoimmunologist for the reason that I mentioned, and that is that autoimmune diseases affect different parts of the body and therefore they present differently, and so the diagnosis and treatment of autoimmune diseases depends upon the particular site in which the disease occurs. So if it's in the brain, a neurologist; if it's in the skin, it could be a dermatologist; if it's in the connective tissue or the internal organs, it may be a rheumatologist, or if it's in the endocrine organs, it would be an endocrinologist, and so on. So there is no single specialist that handles all forms of autoimmune disease. They are clinically too different, and at the moment the diagnosis and treatment of autoimmune disease is too different. Now the future we don't know, and as we get closer as we are to the root causes of autoimmune disease, and our new medicines are more and more moving to the roots, it may be someday that there will be people who are skilled in the use of those particular diseases, those particular agents, and will be at least involved, if not primarily involved, in caring for patients, will be involved as consultants in patients. So the brief answer is that if you want to be an autoimmunologist, at the moment you have to choose your specialty. Or like me, you can be a pathologist, because pathology can investigate any autoimmune disease in any organ.
Okay. Thank you, Dr. Rose. With that, we're going to move to our next presentation from Dr. Peter Mekel. I'm going to give over the screen to you, Dr. Mekel.
Can you hear me?
Yes, we can hear you.
Okay, great, because I think I was unmuted before. Hello, everybody. I'm glad to be part of this as well. And I've been working with the Vasculitis Foundation for many years, and great that we're partnering on this as well. I'm charged in the next 15 to 20 minutes to, I'll only show you the whole screen here. Oh, sorry, okay. With giving you a brief introduction to vasculitis, what it is and why it's related to autoimmune disease. And I think Dr. Rose gave a great introduction that I will link and refer back to. As mentioned, I am at Boston University, but will soon be at the University of Pennsylvania. So, let's hold on here. So what is vasculitis? Vasculitis is any one of a spectrum of relatively rare diseases involving inflammation, leaking, or destruction of blood vessels with resulting damage of the tissues and organs supplied by the affected vessels. And it can involve virtually every organ system, although each syndrome has unique aspects. So essentially, it's a plumbing problem. If your blood vessels are leaking or damaged and the blood does not reach an organ or an area, that is very bad for that organ or area because it's not getting the oxygen. Some key points about vasculitis are that these are mostly rare diseases, very varied presentations, meaning that one patient may have three different organ systems involved. Another patient may have a different one, and different types of vasculitis look very different, but they have a lot of things in common. They're often delayed in diagnosis because they're not thought of quickly enough by doctors or patients, mostly doctors. It's often a very serious organ and life-threatening problem, and it can involve any organ system. So everything in the body can be affected by vasculitis. The treatment for vasculitis is often what we say is aggressive, but it can be quite effective. That is, we give very potent medication, some of which can cause problems. But we, in general, can treat our patients pretty well. The relapse of vasculitis, unfortunately, is common, so people may get treated and they may have a relapse later. This is a picture of, think about the blood vessels in your, can you see my little arrow as well?
Yes.
So on the left side of the screen is a huge, let's say the aorta, a huge artery. It's very, very big. It's actually even bigger. It's not that big in real life, but it's bigger relative to the other ones. And to the right of that is still a pretty good-sized artery. This is the blood that leaves the vessels that leave the heart and go to the outside of the rest of the body. To the right of that is yet another size one, and then you can see another little dot. And what you really should see to the right of that, if you can't, would be a very, 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 very small, microscopically small capillary. So there is a 1,000-fold change in the size of the vessels from when it leaves the heart to when it gets to your skin or to your kidney and the end parts. And what I'm trying to show you here is that there's a great variety in the body. And because there's all these different types of vessels, there's different types of vasculitis. And here on this slide, we show that there's what we call predominantly small vessel disease, predominantly medium vessel, or large vessel. And these are different types of vasculitis, and some types of vasculitis have no vessel size that it's particularly like, so they go all over the place. In each of the circles is a name of a vasculitis or even a group of different types of vasculitis which are common, which are associated with that size vessel. So as all these words or abbreviations on the screen are different types of vasculitis based on whether it's a large vessel, medium vessel, or small vessel. Another way to look at it is here. I won't spend too much time. This is a slide of many names of different types of vasculitis. Can be confusing. It certainly is the one that scares our medical students. But what it shows you is there's many types of vasculitis, there's a family of diseases that are all related by the fact that there's inflammation of the blood vessels. So who gets vasculitis? Well, although many different types exist, and their specific forms may be based on sex, age, or race and ethnicity. So for example, for some diseases such as Takayasu's arteritis, it's more common in women, but in other diseases it's equally common in men and women. In some diseases such as giant cell arteritis, it's more common in people who are 60 older, or basically exclusively there, while another disease called Kawasaki's occurs almost exclusively in children. So there's great variety. But everybody, unfortunately, is at risk for some type of vasculitis. We see it in people of any age, men and women, all races, and people around the world, although, again, different types in different places, which may get into this whole idea that Dr. Rose was talking about both genetic predisposition, so where you're from, or where your original people were from, so to speak, and geography, because there may be a difference, and there's been some thoughts about that too, that there may be an environmental predisposition. I'm just going to show a series of pictures that shows you the variety of what vasculitis can do. Here you see what we call purpura. This is, think of the small vessels in your skin leaking because they've got inflammation. Blood is leaking out, and you get these purplish, reddish-looking bumps. Here is does my arrow show up?
Yes.
Okay, so here you see something called Polyarteritis Nodosa. This is dye in the blood vessels in the intestines. And here you see it should be a nice, smooth avenue like this, nice, smooth vessel. But what you see is all these lumps and bumps, and that's because here it's kinked. There's inflammation, and it's narrowed. Here it's narrowed. Here it's narrowed. This is vasculitis all over this person's belly. Not so good because not as much blood is going out here where it should be. This is a medium vessel vasculitis. This is obviously a problem. It's a young woman's toe. Not enough blood getting to the toe. It's getting gangrene, and that's because the blood vessel in her foot is all blocked up with vasculitis. This woman actually ended up doing quite well later, and most of her toe was saved. So here is the aorta. This is coming right out of the heart. This is the main vessel that leads to the entire body. It's narrowed where the arrows are. Here it's very, very narrow. It's 5% of what it should be. Not good for the rest of the body. This is Takayasu's arteritis. Inflammation in the vessel wall causes this to narrow down. We actually were able to fix this through a procedure, but in general, this is not generally good to have. This is a young person with inflammation of the blood vessels in the heart, the coronary arteries, and this is an interesting disease called Kawasaki's in a young child. This is blood leaking out of vessels in the lung. On X-ray, you can see it's all this white stuff is blood. This is a particularly dangerous problem in certain forms of vasculitis because the blood vessels in the capillaries are leaking. So this size vessel is 1,000 times smaller than the aorta I showed you just a few slides ago. Sometimes vasculitis causes inflammation that's not clearly vessels per se. This is a nodule or nodules in the lung. That's full of vasculitis as well. And this is a kidney biopsy, unless you're a kidney doctor or used to seeing these a lot like we are. This is sort of a series of blood vessels. You can see there's blood vessels involved with this kidney, and under the microscope we see inflammation and damage to the kidney, and that's vasculitis. It can cause damage to the nerve so that this person cannot lift up their hand. Again, this can be improved with time. This is inflammation in the blood vessels in the eye, and this is can be a problem. These are sores in the mouth that can be quite annoying. And what you can see is that the variety in vasculitis is huge, but the basic principles are very similar. The inflammation of the blood vessels leads to blockage or destruction of the blood vessels, leads to tissue and organs downstream are not happy, and this is not good for what's down there, where the blood's supposed to go. So what causes vasculitis? Well, we're not exactly sure, but we think autoimmunity certainly plays a role in some forms, maybe all forms. Most of the causes are not known, the exception being that some drugs you take, actually that's a pretty common problem, is you take a drug and you get a rash. Sometimes that rash is actually vasculitis or other problems from drugs. Some drugs cause other types of vasculitis. And some infections can cause vasculitis. But many of the vasculitis we see, we don't know the cause, but there are theories, and that includes autoimmunity, infection, environmental toxins, and genetics. So just as Dr. Rose said, we think there is, and I'll show some evidence later, that people's immune system are attacking themselves inappropriately. It's not what the body was set up to do, causing inflammation in the blood vessels. Perhaps in combination with an infection, sets it off, maybe something in the environment, and maybe they have a certain gene or set of genes that makes them more likely to get this. And so we think there's probably a combination of all of these things in different types of autoimmune diseases. I think we don't know what. I don't say they're all from infection, but some diseases may be set off by some things, some by others, and we don't really know, and we're trying to figure that out. But you could argue that autoimmunity is the basis for some of these diseases influenced by these other problems. The treatment of vasculitis I'm going to mention briefly because it's important to understand. We want to reduce the inflammation and the short-term, that helps very quickly. But what we really want to do is suppress the immune system. So if the immune system is attacking the body, we want to reduce the action of the immune system to allow for the body to recover and hopefully cure or at least suppress the disease for a long time. You have to be careful because you don't want to get rid of the immune system completely. It's very useful to fight infections. Treatment depends. The more severely ill someone is, the harder we will treat them. Our goals of treatment, obviously, to save the patient's life, prevent damage, to prevent problems from the drugs that we give, but really to improve the quality of life and get people back to living and not thinking that they're just a patient with vasculitis. We want to prevent relapses. We want to avoid undertreatment, and we want to avoid overtreatment. It's like Goldilocks. You want to get it just right, and that's a balancing act. You want to suppress the immune system, but not too much. Many of our patients, even though I showed you yucky pictures, many of our patients do quite well, but we could do even better. This is just a slide of different treatments. What I want to show you about all of these treatments when we start and then we later put them on another drug is that all these drugs alter the immune system and treat autoimmunity. They're used for not just our diseases, but some of these are used for some of the other diseases that Dr. Rose was talking about. It alters the immune system. So what evidence do we have that autoimmunity is important in vasculitis? Well, perhaps the biggest evidence is that there are antibodies. So your body makes antibodies, which are proteins, to fight off an infection or fight off, or not exactly proteins, but they make chemicals to fight off infections or other problems. When you make antibodies against yourself, we call them autoantibodies, and it's generally not a great thing to have. There are two particular antibodies that are very interesting in vasculitis, different forms of vasculitis. One is called ANCA. It's probably the most famous of the antibodies in vasculitis, anti-neutrophil cytoplasmic autoantibody. Just remember it's an antibody. We think there is evidence that these antibodies, which is a very strong marker for a certain type of disease, type of vasculitis, actually may be involved with causing the disease. The presence of these antibodies really makes us think there's an autoimmune problem going on. Another disease called anti-GBM disease, it used to be called Goodpasture's disease, is another antibody. These are particularly go against the capillaries and the kidneys. Again, when you get rid of the antibody, the disease actually goes away. So these antibodies that the patient makes against themselves tells us it's an autoimmune disease. Another evidence level of evidence that diseases may be autoimmune is that the genes that seem to be involved in other autoimmune diseases, like rheumatoid arthritis or lupus or even multiple sclerosis, are also seen more frequently in patients with vasculitis, or at least some types. Dr. Rose talked about the MHC system, the immune system. Here's the HLA. So certain genes that refer to the immune system itself are more common in patients with vasculitis than in other people. So again, another hint, antibodies, and then the hint that genetics may play a role related to autoimmunity. There's also links to autoimmune disease and other diseases. Notice these are other types of diseases thought to may be autoimmune, such as hypothyroidism. Dr. Rose spoke about. Patients with certain types of vasculitis seem to be more likely to also have these other autoimmune diseases. And again, we're thinking autoimmunity is something in common here. Finally, or two more things, vasculitis also occurs in other autoimmune diseases. So lupus, rheumatoid arthritis, can also have vasculitis. So some patients with these diseases have vasculitis as part of their disease. Again, there's this theme that these autoimmune diseases, they overlap with one another. So there's maybe something in common that's causing them. Finally, the fact that we can give drugs that suppress the immune system and make patients better also make us think, well, if we're suppressing the immune system, the patients are getting better, maybe the immune system is involved in causing the disease, and maybe it's autoimmunity. So these are both direct and indirect hints on this slide that make us think autoimmunity is probably playing an important, maybe a primary role in at least some of these diseases that we call vasculitis. It could be that it's, again, a combination of autoimmunity plus other problems. So, in summary, there's much more to learn. We really need to know much more about what autoimmunity is and how it affects people with vasculitis in particular. It is certainly a major factor in at least some forms and some stages of vasculitis. And if we unlock the secrets of autoimmunity in general or in specific diseases, this will help us understand and treat many diseases and patients. And this is, I think, something people often don't realize is that we may learn about how to treat vasculitis because of treatments that are in multiple sclerosis and vice versa, or because in laboratory studying autoimmunity, there's a new finding that we can then apply to the patients and back and forth. And so it's often helpful for people who are interested in a particular disease to realize that research in general can help them in other areas. So I'm going to end, and I thank the hosts for allowing me to present. I hope this was useful for you to understand vasculitis, why it is in the family of autoimmune diseases, and why we are very interested in learning more and trying to understand autoimmunity so we can treat our patients and get them better. So I'll stop there and take questions.
Okay, we do have a couple questions. One person asked, if you are taking a drug to suppress one autoimmune condition, can that prevent you from developing others?
It's an interesting question. It's hard to know if you're preventing something that hasn't happened. So the absence of something is difficult to know. But the answer is probably. But I will tell you this, that we have patients who have more than one autoimmune disease or inflammatory disease, and when we treat them for one, their other one often might get better. A good example of that is psoriasis, the flaking disease of the skin, is actually pretty common. Whether it's truly autoimmune or inflammatory, not that sure, but when we treat our patients for vasculitis or lupus, with certain drugs, often their psoriasis gets better. So sometimes one thing can treat another.
Okay. In the interest of time, I'm going to go on to the next presentation, but I will shoot over these questions to some of the presenters just so that they can type an answer. Okay?
I will apologize ahead of time. I may, as previously scheduled, have to leave to go to the airport, but I, again, appreciate the opportunity to present tonight.
Thank you so much, Dr. Mekel. Okay, our next speaker will be Patricia Barber, who is the patient educator at ARDA.
Hi, good evening or good late afternoon, I guess, for some people. What resources does ARDA have for people? Let me tell you a little bit about us. We were founded in 1991, and we are the only organization dedicated to bringing a national focus to autoimmunity as a category of disease and also as a major women's health issue. As you all are aware, that at least 75% of the people with autoimmune disease are women. We also promote a collaborative research effort in order to find better treatments, prevention, and a cure for all autoimmune diseases. What do we do? Under the education umbrella, we voice the needs and concerns of people affected with autoimmune diseases to state and federal governments through our advocacy programs. We facilitate the National Coalition of Autoimmune Patient Groups, commonly called the NCAPG. That's one of our biggest ARTA projects, and it is a coalition of 29 single disease groups who have banded together to speak with one voice. One of our member partners is the Vasculitis Foundation, who is co-presenting this webinar with us. We've launched the National Alliance for Autoimmune Awareness program. We have our What Every American Needs to Know About Autoimmune Disease public awareness campaigns. This webinar is part of that. We go all over the country presenting these also. We have great PSAs, Men Get Autoimmune Diseases too. Do you know your AQ? AQ is a play on IQ. Do you know your autoimmune quotient? That basically means, do you know if you are an autoimmune family? And if you are an autoimmune family, it's wise to know that, to tell the other members of your family that if they're suffering some seemingly unrelated symptoms, that you mention it to your healthcare provider, that you do have autoimmune disease that runs in the family. A great place to see all these PSAs is on our YouTube channel, and feel free to share them. Under patient services, we have information about the various autoimmune diseases. We have referrals to sometimes specific physicians. If not a specific physician, we can usually find the patient the best specialty to go to. A lot of times people don't know which medical specialty to go to. They should see a gastroenterologist or a rheumatologist, etc. On our website, we do have a great forum. We have almost 2,000 people on this public forum. It's a great place to discuss anything you wanted to know about autoimmune. We do also offer crisis intervention, able to help people in a crisis situation get some help. Under research, we fund basic and clinical research. We host scientific meetings, conferences, and colloquiums. One of our successful scientific meetings is Autoimmunity Day, which is now in its 12th year at Johns Hopkins University. This is a program that we would really like to expand to other universities. We fund summer fellowships at Johns Hopkins. This is to interest young investigators into potentially making their careers in researching autoimmune diseases. What kind of resources are available on our website? Here is the front page of our website. If you see in the center, news and updates, that's where we put items that are happening now or very important things that we want to tell you. On the right-hand side, under About ARTA, you can go down to the Autoimmune Coalition, and that is a list of the 29 groups that belong to the NCAPG, and that they also are their portals to their individual websites. My next page won't next page. Well, I can't turn my page, but I will tell you that the next slide I was going to show is under the newsletter category right here on the menu bar, and that is just a place where you can see selected articles from our In Focus newsletter and also past articles from that newsletter. Taking you across the top of the menu bar The next menu bar is the autoimmune information, and that is where we have patient information. We have educational modules that are on our web now. We have a basic autoimmunity module that is up there now. We have one on rheumatic diseases that should be up within the next couple of weeks. We're just doing the final voiceover on that. We have current research reports. We have archived research reports under there. Under this tab is also our brochure on the common thread, which is a very great explanation of autoimmunity and autoimmune diseases that was written by Dr. Rose in lay language. We also have our brochure on autoimmune diseases in women. Across the top here at the very end, you can find our forum. It's a great place to talk about your individual diseases. There's some coping skills that people share on there, etc. What can you do to help? You can advocate, volunteer, fundraise, subscribe to us, donate to us. You can join us on our social media. Right over here on the left-hand side is links to our Facebook page, our Twitter account, and our YouTube videos. That's the best place to keep abreast of what we are doing right now, and it is a wonderful way to keep your family and friends updated on what's happening in the autoimmune world by sharing the posts that we do on Facebook. I'm going to turn this back over to Christian. Thank you very kindly for your attention.
Thank you, Pat. Now, lastly, we're going to go over to Joyce Coleman from the Vasculitis Foundation.
Good evening, afternoon, everyone. Thank you for joining us. I'd also like to thank ARDA for allowing us to co-present this with them, and to thank Dr. Noel Rose and Dr. Peter Mekel for their time tonight and sharing their expertise. So can everyone see my slide?
Yes.
Okay. So the Vasculitis Foundation was established in 1986 as the Wegener's granulomatosis support group. Our mission is to support and empower patients through education, awareness, and research. The VF partners with patients, families, physicians, researchers, and other patient support organizations to improve the lives of our patients. We have 3 programs: awareness, support, education, and research. And as we all know, awareness with a rare disease is quite challenging. As this cartoon says, it's a very rare disease. It doesn't have a cure. It doesn't even have a spokesperson. So we look at awareness as a 365-day effort by our supporters, by our members, families, the medical professionals. We host a Vasculitis Awareness Month each year in May, and we encourage all of our supporters to organize different events, walks, runs, health fairs, golf and baseball tournaments, dinner benefits, trivia nights, music evenings, almost anything that a member is interested in doing as a way to raise awareness of vasculitis and of the VF services. We also this past year have really expanded our focus on the use of social media, encouraging our individuals and our members who are on Facebook and Twitter to really share their stories with their friends and family and coworkers. Our support and education program, information and resources, not only to newly diagnosed patients, but patients throughout the spectrum, from newly diagnosed to remission and after. We also encourage patients to become partners in their healthcare team and to become advocates for themselves. When you're diagnosed with a rare disease, you often have no idea what this is going to entail, and you have to become your best advocate to really search for the best physicians treating the disease and to advocate for the best treatment. We also at the VF promote wellness. You know, what do you need to do? This is a chronic illness. What do you need to do to take care of yourself? We encourage appropriate screenings, you know, best nutrition, exercise, stress reduction techniques. What can you do to improve your life. Even though you have vasculitis, it's something that you have to live with, you have to learn to manage. We also have support groups around the country and internationally, and we encourage our patients and families to join the support groups and get involved and just learn from each other. And we also ask our members to participate in advocacy efforts to raise awareness of vasculitis and also to raise awareness of the need for increased funding of research on vasculitis and other rare diseases. The VF also has a research program which was established in 2001. Earlier this year, we reached over $1 million in funding research on vasculitis. We fund up to $150,000 in grants per year. These are individual grants of up to $50,000 per year to investigate interesting studies on developing better treatments, trying to determine what causes vasculitis, and to hopefully discover a cure for the disease. Our research is focused on improving the lives of our patients. The VF is an international organization. We have chapters and support groups around the world. We provide information to patients anywhere in the world. It's amazing what the internet has done, connecting us with patients all over the world. We also collaborate with other patient advocacy groups around the world. Our vasculitis groups such as Shirk-Strauss Syndrome Association and the PAN Network Support Group and ABDA, the Behçet's group. We also work with the patient support groups in the United Kingdom, Germany, France, Australia, Canada. Our goal is to bring our patients together so that together we can make a difference and increase the amount of research being done and improve the lives of all of our patients. Our VF medical consultants are recognized around the world as the experts in vasculitis. They donate tremendous amounts of time to share their knowledge and expertise. Not only do they take care of our patients, they also perform the research and also teach to bring younger physicians into the vasculitis world. We also offer newsletters, bi-monthly newsletters to our members. They are bi-monthly, they are in print and electronic format. We also believe very strongly in education, and we host annual and biennial symposia and also regional symposiums. In April 2012, we will be hosting a patient symposium in Chicago, Illinois, and then later in July, a patient symposium in Atlanta, Georgia. I would encourage you to visit our website to learn more about what the Vasculitis Foundation does and what we offer, the services we offer. What can you do? I will repeat what Pat suggested for the ARDA supporters. Join the Vasculitis Foundation, volunteer for the organization, fundraise to help support our programs of awareness, education, support, and our research program. Support the VF's mission to improve the lives of all of our patients. Connect with others through Facebook and other social media, and visit our website, www.vasculitisfoundation.org. Together we can improve the lives of our patients and find a cure for this disease, find out what causes it and cure it, and develop better treatments for our patients. Again, I'd like to thank ARDA for this opportunity to participate in this event and to thank the speakers. Thank you.
Thank you so much, Joyce. That concludes our webinar for today. This webinar has been recorded and will be posted on the ARDA website by next week. So you can check the ARDA.org website, which is aarda.org, and visit our website, look at our resources, and if you'd like to view this again or share it with friends and family, it will be posted on our website. So thank you all very, very much for joining us on our first webinar. We will have 2 additional webinars centered around the topic of vasculitis and autoimmunity, one in November and one in December. So watch our website for times, join our Facebook group as Pat suggested, and our Twitter page so that you can stay up to date on what ARDA is doing. So thank you very much for attending the webinar, and we hope to see you next time. Bye-bye.